Hi, guys. Good afternoon to everybody wherever you are joining from. I am Devon Malcolm Brewster, Managing Director here at HyperAcademics Jamaica Limited, and it is my pleasure once again to welcome all of you to the third day of MedSkool KickOff, an initiative led by HyperAcademics Jamaica Limited in partnership with student leadership organizations all across the Caribbean. As you know, the intention is to introduce medical and dental students of the University of the West Indies to medical and dental school from a student-led perspective. We have been on this journey for what? About 2 days now. This is the third day, and we've been having fun. The feedback has been exceptional, and we are just elated that we are able to have an impact on the lives of medical and dental students across the Caribbean. I want to first of all apologize for starting 5 minutes late, which was due to a technical difficulty. But I must caution you as well, in addition, that here in Jamaica, particularly in the Kingston area, there is a bit of inclement weather with thunder and lightning. So you might hear thunder and lightning in the background of our speakers. But it also means that there is very much a possibility that there might be a power cut or anything of that sort. So just in case that happens, we want to apologize, as obviously it's an act of God. We have no control over it. But while we are still here, while we are still connected, we are going to try to have as much fun as possible. So as you should know, our intention for today is we're going to first of all have a riveting discussion with two wonderful young ladies on the topic, what if medical or dental school is not for me? Now, that topic is a topic that I think is of paramount importance for us to discuss, because so many times, as I would have alluded to briefly yesterday, many medical and dental students start the journey, and either it's a case where from the onset, they are not sure if this is actually something they want to do, and they pursue it because they feel pressured by whoever, it might be family or friends. But there's also a case where, or cases where students were, when they join the program, they may start, they may think that they want it, but eventually they recognize that they want something else. And I mean, many of us can have testimonies of seeing where different people have encountered that sort of conflict as to whether or not they should take that decision to change their plans or to continue on a path that they are not so sure is right for them. And so for these people and for all of us, this session is for you, whether you are new to medicine or dentistry, or you are a student already, or you may not be a medical or dental student at all, but you may have to contend with medical or dental students who have this challenge. And it is important for you to know how to identify this when it is that persons are going through these challenges, and also how to deal with it when it comes. So that was a long preamble. You get the point. We have a wonderful, very important discussion this afternoon, and I will shortly introduce our two wonderful speakers. After that, we have our second and final mini academic session. As you know, we are planning to, and we have been having these very brief academic sessions, nothing too difficult, nothing too hard that requires you to do any prior research, just to give you a taste of what medical and dental school is like. And so we're going to have representatives from the University of the West Indies Surgical Society who will be leading us through Locomotor System, just some very basic concepts. They will start by first telling you about them and what they do, and then go into some basic locomotor. Nothing long, nothing excessive. Very soon, we will be out of here. So without further ado, we're going to kickstart this kick-off, day 3, with our first session, which has to do with what if medical or dental school is not for me. So we have, as I said, we have two wonderful ladies who will be leading us through this discussion this afternoon. First of all, we have Miss Sienna Lunan, who is the president of the Jamaica Medical Student Association. Hi, Sienna, how are you?
Hi, I'm doing great.
One,
Just a little thrown off by the weather, but I'm doing good and I'm
oh,
looking
that's
forward to the
fine.
session.
You'll be perfectly fine. I'm very happy that we have you, and I look forward to hearing what's in store. We also have Miss Jada Brown. Miss Jada Brown, she's a woman who wears many hats. So she is a vice president of internal affairs for the Jamaica Dental Students Association, as well as she is the president for the DDS, well, DDS class of 2025. As you may or may not know, the MBBS DDS class of 25, or any class rather, is one class up until a certain point where they kind of go their separate ways. And so they kind of have a co-president structure up until that time when they separate. And so Jada Brown, a dentistry student, is the president for the DDS class of 2025. Jada, how are you?
Hi, I'm doing fine. I'm really excited to speak to everyone today. I know this can be sort of a sensitive topic, but we're here to guide you guys, we're here to help you guys, and really looking forward to the discussion.
Wonderful. Thank you so very much for being here. And we look forward to what you have in store for us. But actually, I just realized that I forgot something very important, which I should not have forgotten. We actually have an icebreaker planned for you. But just before I invite Xavier to talk to us about, or to bring us that icebreaker, the one academic part of our icebreaker, I just want to find out, where are you coming from? So whether it is you're joining on Facebook or YouTube, just put in the comment section where are you coming from, whether it's Jamaica, Trinidad, Barbados, or any other island. Let us know where you're coming from. And also, I want to know, if you're a new student, did you attend your orientation today? And was it good or was it bad? So let us know in the comment section that you're here. We want to know that you're here. We want to know that you're hearing our voice. And we also want to know that you are excited for what is to come. So in the comment section, just let us know where you're coming from. Please, 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 please. We really, really, really want to know. Man, it seemed like the comment section kind of dry. Oh, see them there? Oh, yes. It takes a little while for the comments to show up on my system. So we have Jamaica, we have Tobago, not Trinidad, we have Tobago. We have, oh my God, Xavier is in St. Kitts today. Wonderful. We have Mark Davis, who is joining straight from Yard. Um, we also have Delicia, who is also from Tobago. Tobago is out and representing. We have Madison from Jamaica, Angelique from Jamaica, Rayshon from Trinidad and Tobago, and he says that orientation was nice. That's great. We have Melissa from Trinidad. We have T Green in Jamaica. Xavier is claiming to be international again. We have Faith from Barbados. We have Jimmy Christian from Jamaica, and he's also saying that orientation was great. So fantastic. We are glad that we have everyone, and we're going to go straight into our topic, our first aspect, which is where we discuss, what if medical or dental school is not for you? So I'm going to invite Sienna and Jada to just take us through what they have in store for us today.
Hi, guys.
Hi everyone. I'm so glad that you could join us today. Um, yeah, so quick disclaimer. By no means trying to discourage anybody from not doing medicine or dentistry. Just want to get it out there. But it's just a session to help you figure out what you want to do and if it's right. So, Jada, you can go ahead.
Okay, so before we get into the meat of the matter, out of curiosity, I would just like to know from you guys in the comment section, if you were not pursuing dentistry or medicine, what is it that you think you'd be pursuing now? So if it wasn't this, what would be your second option? I just want to have an idea of everybody's mindset here. Okay, so I'm seeing Angelique is saying pharmacy.
Um, Engineering, medical physics. All seem to be science based.
Yeah, I realize. So we have science minds here. Except I saw international relations.
Oh, that was me.
Yeah, I think I'd probably be a teacher. Explains right. No. Okay. Mark said theology.
Physiology or theology, chemistry, optometry, finance,
Right. So we have
actuary.
quite a bit of alternatives.
Yeah.
Well, that's cool. That's pretty
But I also want to
interesting.
point out that we actually have some persons who say that they're not too sure, and that's also fine.
Yeah. Okay, guys. So now that we're just asking questions to kind of get a feel of like where your mind is at and what you're interested in. So to start off the session, we definitely before we even dive into the whole thing about, oh, is medicine for me, is dentistry for me, we want to talk about the realities of medicine and dentistry, right?
Mm-hmm.
So the first thing is that the workload, right? Especially those transitioning from high school, like it's going to be like a train hitting you, right? It's going to be a lot, um, uh, coming at you all at once. But that's just the reality of it. I think the misconception with medicine is that you have to be smart, and I think being smart is relative.
Mm-hmm.
But it's really about consistency and discipline. Like, are you able to consistently um, keep up with the workload, study when you need to study, go out of your way to ensure that you're on the ball with and keeping up with school, lectures, all these things, right? So I think that's the first thing that person's kind of like you're hearing it from us now, but you won't understand until you guys start next week.
Yeah. And the first week will be sweet to you guys. It'll be probably your favorite week. But yeah, the workload is huge. As in the transition, I'm sure you guys have heard us discuss it being like a fire hydrant shooting at you, the amount of information you're forced to absorb. And that is exactly how it is. And that's just a reality of being in medical and dental school. Um, a next reality that there is that you will have to be able and willing and able to make sacrifices as a medical and dental student. Meaning you're going to have times where you have to say, I'm sorry guys, I can't come out today, or sacrifice a couple hours out of your sleep schedule, etc., etc. And if it is that you're not up for the sacrifice, it might be a lot more difficult for you throughout the years you'll be spending in school.
Mhm. Yeah, and it's a very high pressure work environment, especially when you get to clinicals. Like, it's going to be very high intense. You're going to be asked questions on the spot. Even throughout your pre-clean years, you'll be asked a lot is going to be asked of you, right? And you have to be on the ball. And sometimes it can be daunting, right? And sometimes you will not, let me tell you this from now, right? I know you're coming from a point where you've done very well, right? Because you've done obviously had to do very well to get where you are, right? But at the same time, medicine is it's right now this is a new phase of your life, and you're kind of figuring it out as you go along, right?
Mhm.
So everybody's different. Your experiences will be different from mine. It will be different from Jada's. So you just have to take it one day at a time. So let me tell you, you will not know everything, right? You will not. Medicine and dentistry are vast in knowledge. Every day, new information come out, new medicine comes out all the time, right? So you won't always know everything, and that's okay. That's literally so okay. You're here to learn as you go along. Try, and I think it's easier said than done, but when that time comes, just don't take things too personal, right? Just know that it's for you to work through, and yeah.
Yeah. In terms of not doing anything, if you are somebody, I'm sorry, not doing everything. If you are somebody who knows everything, you're probably not human. You need to go and get that checked out. Extraterrestrial, like the information is literally almost impossible, maybe impossible to be absorbed all at once and actually stick. You have to consistently study, you have to be consistently reading, and a lot of the content that you're expected to cover, you will have to read on your own. You're probably not told directly. You have to read on your own, but you have to do outside reading, outside of what is put directly in your face. And that is one of the reasons why you will not know everything. Um, yeah, we wanted to look at medical and dental school and your personality. So, another question we like to throw out to you guys is, what personality trait do you have that you believe will be an asset to you as a dentist or a medical doctor?
Drop it in the chat, guys. What about you? Like, is so like what is something you know about yourself that will truly um add to you as a physician and add to your patients, your future
Mhm.
patients? You seeing any responses? No.
No, I'm not seeing any. They're probably soon come up. They're probably like this lagging on our end, right? You guys are answering.
So I hope so. Okay, so I think that's Rayshon. He says that he's a logical thinker. Um, yeah, logical thinker. Makari says, I'm a people's person. Listen, you have to be a people person. Have to, have to, have to, have to,
Mm-hmm.
have to. Um, Empathetic. Yes. Tenacity. Love that. I'm a hardworking team player all the way. If you're a team player, you'll make it very far.
Yup.
Maya, I'm not judgmental. That's also
That's
something very important.
super,
Yes.
super important.
Empathy. We love to learn. Understanding. Angelique says she loves learning about people's experiences. Okay. I'm really loving the responses so far.
Yes,
Like, yeah.
I really, really love that. I think I'm relatable. Okay. Yeah. That's also really good. Thanks, Devon.
Okay.
Well, yes, the reason why we asked this question is because, and Xavier is caring. Okay. So the reason we asked this question is because as a junior doctor, or you're a doctor in the future or a dentist, you will be exposed to a lot of people. They'll be coming from different religious backgrounds, different socioeconomic backgrounds, and because you guys mentioned, most of you mentioned, being open to people, being caring, being empathetic. That is super, super important. As a physician, you cannot show any sort of bias or,
You can't be
judgment.
callous.
Yeah, you
You
can't
can't be
towards
callous.
your patients. They
Mm-hmm.
should be comfortable around you. They should not be afraid to tell
Mm-hmm.
you what is wrong. they should want to come back to you. And you
Mm-hmm.
have to have an open mind. You can't be too rigid when it comes on to religion, because you're going to meet people with strict practices that may go against what you want to practice or
Mm-hmm.
what is right for them. But you have to find ways to communicate with them in a way of understanding, but also, doing what is right for the patient. So
Yeah.
that's super,
And
super
I
important.
want, yeah, and I want to add to that, Jada, especially those who the empaths, because I'm kind of that way. But there has to be balance as well, because if
Mhm.
you're too empathetic, it can take a toll on you personally. As in, if you become too attached, or you're too like your emotions can get in the way of you making decisions. So that's also something that you're going to have to learn to kind of balance out, not just as a physician, but even as a medical student, no, because you'll be interacting with patients from your dental student, from your medical student, right? Yeah, so even when it comes on to being understanding, okay, here's the thing. When you become a doctor, your main goal is to give the best care possible, but you have to keep in mind that have to you'll have to abide by patients' wishes. Like if a patient decides not if a patient refuses treatment, there's nothing you can do about it, right? Another thing to that is prevalent in the Caribbean, Jamaican um, working environment is that there is actually a lot of discrimination against certain groups. So when we think about HIV patients, right? When we think about patients with LGBT, the LGBTQ plus community, when you think of patients who have certain beliefs that are against what we believe, or against or moral construct, whatever it may be, just always keep in mind that the patient is a person first before anything else, right? They're humans and they're there for you to take care of them. So that's another thing for personality. Sometimes you have persons that kind of rough and tough and kind of want to say no, but this is what's best for you. It can't be that. It can't go that way, right? So yeah. um mhm. Was there anything else that we wanted to add on that point, Jada?
Yes, a lot of the comments mentioned their love for learning. So they love to learn. Getting what I get from that is, okay, if you love to learn, that is extremely good, because as a physician, you know, as a medical and a dental student, you will never stop learning, ever. You will never ever stop learning. You're in school for the rest of your life, because after getting into the practice, that doesn't mean school is done. You're going to be learning while practicing. Things are going to change, findings will be made, and you will have to adapt to those. You will have to learn those to deal with
Mm-hmm.
your patients, to be a good physician. So it's really good to see that you guys love to learn. If it is that you're
Mm-hmm.
one of those people that, oh, I don't like school, I don't like learning, think about it. You'll be learning forever. You'll be learning forever and ever. So,
Rough and
That's
tough.
that's actually so true. I like how the discussion is going so far. And just in case it's not clear for anybody, the topic being what if medical and dental school is not for you? As Sienna made the disclaimer from before, it's not that we're trying to discourage you from coming into medical or dental school. In fact, if you notice that they've been taking a positive slant by telling you, okay, what exactly is medical school and dental school going to require from you? And many of you have stated it. For example, your strengths like empathy and your tenacity and your willingness to learn and so forth. And these are the things that you actually need. And I think the intention is that for you now to say to yourself, okay, these are the things that I should expect in terms of what is expected from me as a student. Now I must determine if I am able to give what is expected of that's correct, right? Yeah,
Mhm.
you make that determination. Sienna cannot tell you say you need to drop out,
Yes.
or Jada cannot tell you, yeah, you look like somebody who not really, you don't really look like you're ready for medicine. No, none of us can say that. It's
Mm-mm.
you to make that determination.
Yeah. So
Yes.
I
Mhm.
personally am not the greatest at studying, and I know that as a dental student, I have to study. You need to study. You can't wing your exams. So, knowing that I'm not the greatest at studying, I had to find ways to study without feeling like I'm studying. So, active discussions, super helpful. I know what I signed up for. I know what I'm going into, and that's what we want you guys to have an idea of. What are you getting yourself into? That's basically it. You're not always going to fall perfectly along the lines. There might be a list of descriptions that make the perfect doctor or the perfect dentist, but it's for you to adapt, it's for you to be aware and, just go with the flow, figure it out, you get it done. If this is something that you love, if it's something that you want to do, it will not be too hard.
Yes, Jada, and I completely agree. Because even because you see, the thing is, if you have the thing is, if your motivation for doing medicine is in the right place, like you will jump over the hurdles that will come your way. Trust
Mhm.
me. Like medicine and dentistry is not easy. Okay, that's just facts, truth. And medicine is also not for everyone. Dentistry is not for everyone, and that's okay,
Mhm.
right? So when we think of motivation, you want to think of, is it intrinsic or is it extrinsic? Extrinsic being, for instance, if your parents pressuring you or family members pressuring you to the medicine and you're hesitant, yeah, it's not going to end well if that's your motivation for doing medicine,
Mhm.
right? Right. And then if it's intrinsic, for instance, if you absolutely love interacting with people and you think that this is the best way you can um like encourage that side of yourself, and you love you just love the medical sciences. Oh my god, you love anatomy, you're just fascinated by the diseases and all these things. That's intrinsic motivation, right? And intrinsic motivation feeds discipline, and you need discipline, right, to get through med school. Because let's be honest, you won't be quote unquote motivated all the time, because motivation can last like, no, like you get this talk and you're like, yeah, let me go start studying. No, it done out by tomorrow, and then you're like, boy, I'm not really feeling it. But if it's a case where like you know why you're doing this, and it's for you and what your personal goals are, and this is definitely something that you want to do, like you'll find the discipline to do what you need to do to get what you need to do done.
Yeah, I totally agree with Sienna. That intrinsic motivation, super important. I'm pretty sure we have both had times where we're studying and information is just doing this, and you're like, what am I doing wrong? What's happening? And then all that's running through your head is, maybe this is not for me. Maybe I'm not supposed to be here. Maybe I should just close the book, go to bed, call it a forever. I'm done. But then that fire in you, that passion, that little voice in your head that's telling you, you know that you love this, right? This is exactly what you want to do. Get up
This
and
is
get
what
it.
you're meant for.
Exactly. You were born for this. Nobody wanted you to do this. You wanted to do this. This is your thing. It's going to take you up. It's going to pick you right up and you're going to go for it.
Right.
So you have to always tune into that inner fire that sent you into applying for med school, applying for dental school. Tap into that little superpower that you have and work. Not saying you're going to get up immediately. You might want to just sleep, get up tomorrow, but the fire is still there.
Yeah.
It's
It's
very
basically
important
like,
that it's within you.
it's like you have to remind yourself, why did I start this in the first place?
Mm-hmm.
The thing about it is that people encounter this question from first year all the way up to final year. I know people who even up to the very last moment, under the pressures of preparing for their final MBBS exam, they really ask themselves like, is this really worth it? Do I really want to do this?
Every
Um,
day.
I mean, you encounter the kind of stresses that come with this program, and we're not talking about just. I mean, yes, there's the academic aspect of things, but then there's also having to interact with other students. When you get to the clinical setting, you have to work under this high pressure situations when you have your
Mhm.
residents and your consultants over your neck expecting you to know this and that and what wrongs. It's a high pressure situation that's going to cause you to want to give up very often. But as Jada and Sienna keep mentioning, you have to find that inner spark, that first reason that made you start the journey in the first place. But there's an interesting question that I want to call our attention to. Melissa Ramlal is asking what to do if patients don't listen to you. Now, I mean, I don't know Melissa, but it could be that she's asking that question because she's one of those kind of persons who they like when people do the things that they tell them to do, you know. And so she might be thinking, boy, if I like when people follow my instructions. So what do I really do if patients don't listen to me? And maybe she might be one of those people who feel like, well, if patients not going to listen to me, then maybe I should just find some other profession where people will listen to me. So for Melissa, again, disclaimer, that might not be the place that she's asking from. But what do you think? What to do if patients don't listen to you?
I mean, okay, so here's the thing. Patients usually there's a thing about there's status that comes with being a doctor, right? There's a certain status, you gain a certain authority, even as a medical student, right? There's a certain level of authority. And yeah, so they kind of put respect on your name, kind of. But the thing is, there's a difference between um, them listening to you like in the moment, and then I guess compliance with your, I guess, with your treatment methods. I don't know like the basis of the question, right?
I think
But mm-hmm, you can go
I
ahead.
think what he's getting at is, as physicians, we guide a patient. We tell the patient, okay, you have to. Okay, so as a doctor, you'd say, okay, what do you say as a doctor? Give me a little tip you'd give to a patient before they leave.
Oh, okay, Melissa.
And then, wait, if it is good.
Okay.
Okay, yes. So that's why, okay, when Sienna had mentioned before that you can't force a patient to take care of, you can't force a patient into treatment. They have to agree, right? So for a dentist, on a dentist's.
Oh, I've
Oh,
actually seen that before, Melissa. I've actually seen that before. Um, yes, so right.
that's tricky.
Yes. Yeah. So yeah. So the thing is, so okay, here
First of all, thank Melissa for clarifying her question.
Mm-hmm.
yeah, thank you
Going
so much
everywhere.
because yeah, we were trying to
Yeah.
grab for something.
There are
But
so many
yeah,
people.
okay.
Go ahead, Sienna.
But yeah, I remember a patient like she refused, like she was in the hospital for some time, and she absolutely refused to remove her leg, and it was just supposed to be I think a lower leg amputation, right? But by the time the weeks passed begging and pleading, by the time them done, she had to get an above the knee amputation, right? And the only reason why they even got her, it was constantly telling her what would happen if they didn't. It took a lot of encouragement. But the thing is, I strongly believe in patient-centered care, and patient-centered care meaning the doctor and the patient are partners in the treatment plan, right? And if a patient refuses treatment, there's, even if it's for their own good, even if it's to save their life, there's absolutely nothing you can do about it. And I think it's actually, isn't it like illegal to even,
Yeah,
I'm pretty sure it's illegal
it's a
to
matter
do
of
that.
medical ethics. A matter of medical
Yeah,
ethics.
it's ethics, right? Right.
So
Yeah.
if I
So
could shed some further light on it, Sienna, that as Sienna has mentioned, that everything that you do for the patient, consent is one of the fundamental things that is important. You cannot just decide you're going to do something to the patient or for the patient and they don't know. And it's not enough to say, for example, the person is, let's say they have dementia and they don't understand, so that means you have a free rein to cut off their left foot if that comes to be. No, based on medical ethics principles, anybody who is incapacitated, there's a line of succession in terms of who is the next of kin, who you must get consent from. So bottom line is that if it is, for example, you are not a person who you, or rather you are the kind of person who like when people comply, and that is all well and good insofar as that you understand that, one, you're dealing with human beings, and I mean, a lot of your patients will be adults. Most times, if you have children patients, they have their parents. So the compliance is kind of like the parental issue, to hold the child to get the injection or something. But when you're dealing with adults are big. I feel like the A in adults stands for autonomy, right? We love our autonomy and we don't really like when people infringe on it. So for example, you from your medical knowledge might feel the best thing to do is to amputate that leg, for example, below the knee, before it creeps up, as in the example that Sienna mentioned. But you don't want to do it. We give you the best advice as possible. We don't try to coerce you. You don't do it, at least under ideal circumstances, because we all know that there are some exceptions sometimes. Because I have seen where sometimes like the situation is so dire, and the doctor in question, I mean, yes, she understood that, okay, medical ethics, she has to respect the person's view, but she kind of, she tried her best to convince the guy to actually consent to the procedure, and maybe tried to coerce, only because she thought that that was best for him, which was wrong. And she did, as medical students looking on afterwards, she told us that, in hindsight, I think I got a little passionate, and tried to convince them, because I really and truly knew that if the person did not consent, it was a death sentence. But she was mature enough to apologize to us as medical students for not behaving in the way that we are taught. But what it underscores is that we are all human, and so you might even get the feeling that you're obligated to convince the person, because you know that it's a life or death situation. But at the end of the day, you have to subscribe to whatever they agree with.
yeah, and the key to that is informed consent as well. You have to give them the whole 9 yards, right? And if it's something like a procedure, you have to give them the risks, right? And you have to give the percent chance risk of it being successful and the percent chance of it not being successful. And if they choose to hang on to the percent chance of it not being successful, there's actually nothing you can do about it. So, yeah. And to be fair, patients are going to do what they want to do. They're just going to do what they feel is best for them. Like you'll find that a lot of patients are non-compliant with medication, especially diabetics and hypertensive patients, right? So many Jamaicans are diabetic and are hypertensive as well, and a lot of them, like, they continue to progress because they believe their bush tea is better, right? And that's just the realities of the profession, right? That's just what comes with it. Yeah.
That's so true. But I have a question for you guys. Have you
Mhm.
ever, in your journey so far, remind me, Jada, what year are you in? You're in
I'm going
second,
to
right?
secondary,
Yeah,
but
yeah, yeah. You're going to
spend a
second.
lot of time at the polyclinic. So
Right. And
yeah,
yeah, because dentistry students can basically start at the clinics from day one.
yeah.
But Sienna is in her fourth year. My question is, have there ever been a moment in your journey so far where you felt like maybe medicine or dentistry was not for you? And if you had that time, or times, what did you do to either reassure yourself, or maybe you're still
Mhm.
not sure? I don't know. How did you react?
Yeah.
Let's start with you, Jada.
Okay, so I had a little moment in the lab. I think the second week of school, we were doing wire bending, and I've always been intrigued in orthodontics. I'm like, okay, I want to specialize. I'm going to do orthodontics. And for the life of me, I could not bend those wires. They were stressing me out. I'm sitting in the lab fighting tears. I'm like, just watching my dreams just crash in front of me while these wires won't bend. And it was so sad for me. And I'm like, yeah, this is not for me. And I just started throwing a little tantrum, and I'm like, I'm not doing it. I'm not doing it. And that's not, guys, don't throw tantrums. But, I was very stressed out because I know how much I wanted this, and it just wasn't working. Like, it wasn't working. I'm trying so hard. I'm bending, and it's just bending incorrectly. And I'm like, I can't put braces in people's mouth if I can't bend a wire. Like, it's not gonna work. And the day went by. Guys, this is kind of strange. I went home. I'm a Christian. I pray a lot. I went home, and I was sitting in the couch, and I saw a shadow on the wall. Not a shadow, like a strange light, and it shaped like a tooth. I'm not joking. I'm going to send it to the KickOff group chat. The little tooth I saw on the wall, it shaped like a tooth. And I was like, why is there a tooth shape on my wall? Like, and I just started praying, and I was just asking, because I went home convinced that I'm not going back to school tomorrow because that's it. I'm done. The wires aren't bending. This is not for me. I prayed. I slept. I got up back. The tooth was still shining on the wall. And I was like, that this is a sign and this is for me. I started thinking, what am I going to do then? If I'm not going to be a dentist, what am I going to do? And literally nothing else came to mind. All I could think about is the fact that I am going to be a dentist. I'm going to specialize in what I want to specialize in. And that's it. And when I saw that my mind is set, I'm already decided, I said, okay, this is it. I'm not going anywhere else. I'm going to go to school tomorrow, and I'm going to figure out how to bend that wire. I am very perfect at bending wires now, by the way.
Oh, I love that comment. The wires were stubborn, but destiny was stubborn. So yeah, there have been, like, for me, like, there have been many moments where I have questioned doing medicine. And like Jada, I myself am also a Christian. And before I even, there was something that happened to me, right? Right before medical school, right? That really, like, I knew it was God sent, that really resonated and imprinted in my brain that I had to do medicine no matter what. Right? It was just I just had that experience right before medical school was supposed to start. Right? And throughout my journey in medical school, there have been so many times where things happen and I'm like, no man, like, the things happen and that God is like pointing you in the right direction, like, that this was meant to be. So that's the thing that keeps me going. So in terms of, the most recent situation that happened was actually when I was on my junior surgery rotation, in third year earlier this year. I remember, because as I said, I'm a very empathetic person, so I kind of, I get very overly invested, like overly emotionally invested in situations in terms of, like, with patients, and it's something that I'm working on as well. But I remember the very first day, right? I actually went home. I actually drove home crying. I left the hospital crying because in clinic that day, I heard so many. I was doing UG. It was the UG clinic at the urology clinic at KPH. And I heard the doctor tell so many patients, oh, sir, your prostate cancer has gotten worse. You have to start making plans. I heard a doctor tell a patient that had 3 months to live. I heard patients getting diagnosed, well, this is probably cancer. Like it was so overwhelming, and I kept hearing that over and over. And the way the clinic is set up is that the walls are thin, and I can hear what's happening in the room that I'm in, as well as the one in front and the one beside, and I just kept hearing all of this. And and then the reactions from the patients and their family members, like, I was distraught. I'm like, oh my god, there's so much. Even though there is a lot of good things that comes out of medicine, you cannot cure everybody. Everybody won't be treated. And that reality just really hit me that day. Like, that really hit me that day. And yeah, I've it's been a journey, but I'm trying. But I just find comfort in knowing that it's life, and God will pull us through. Amen. Amen.
Amen.
So
I
that was my experience.
actually want to share that what Jada was talking about exactly. And Jada, maybe you can expound on it a little bit to remind us what exactly we're seeing on our screen.
Okay, so I posted this on the day that I was very stressed out about my profession. As I told you guys, I had given up. I went home and I was like, "Yep, that's it. I'm done." But this tooth shaped, guys, it's a tooth. I'm pretty sure this is a tooth shape. If you agree this is a tooth shape, I hope you can agree with me in the comments. I'm not imagining it. It's a tooth, and I took that as a simple but a very impactful sign. It was something that really, like, it touched me when I saw that tooth, and I was like, yes, 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 dentistry is for me. And guys, prayer is so therapeutic when I'm stressed out, and I just have to pray every time I'm stressed. I pray every time I am, second guessing myself. Every time the work doesn't stick, I pray, and the prayer brought that tooth on the wall, and I'm like, yeah. Mm-hmm.
Yep. There's no denying, like, there is no denying that that's a tooth. And that, honestly, that's so comforting. That's so comforting. There's Yeah, that's so comforting.
I mean,
And I'm
just like all of you. I mean, guys, if I have to talk about the times, the amount of times that I've felt like I need to give up on this medical school journey. I if I have to get $1 for every time, I'll probably be a millionaire by now. But there's one time I want to share briefly with you as we wrap up and make way for the second session, is that when I was in third year, when I entered the clinical setting. And by the way, let me just put a plug in there, because you realize one of Sienna's experiences was in the clinicals. When you actually get to clinicals, you're gonna be excited. You're gonna be excited to wear your white coat and everything. But I feel like when you get to clinicals, you actually have these moments more often than not, because it just goes from 0 to 100 so quick. I mean, you're talking about the pressure and everything, and then also actually getting, because you are now going into the clinical setting for the first time, you have a backstage view that you never really had as a regular citizen, and you see the pain that so many people go through. And sometimes you ask yourself, do I even have the strength to see these sick people every single day? And my one of my experiences was, I had my first patient, and he was so resistant to me when I went to him. My consultant sent me to him, and I went back to the consultant and say, the guy basically doesn't want me to examine him. The consultant went to him and explained to him that, it is part of his medical training, and he's part of the medical team, and we need him to examine you so that we can know what to do for you. Anyways, I examined him and everything, and over the coming days, we got closer and closer, and the person who was initially so apprehensive, he was just becoming so warm. He had stopped taking his medications altogether. Nobody was able to convince him to take his medication, but because of how close we were becoming, he also didn't have family visiting or anything. I was able to talk to him, and I was able to convince him to take his medication. Long story short, one day, Well, for like maybe 3 or 4 days, I was sick, so I didn't go to the hospital. When I went back, he was like, "Oh, Dr. Brewster, so long I haven't seen you. Where you abandoned me and everything and stuff." And I examined him. It was at the end of the day, did a quick examination. I noticed that he was very cyanotic. His mucous membranes were not pink and moist, they were pale. His tongue was blue. He had heart failure. He had congestive heart failure. And basically, he was waiting to get a cabbage done, a coronary arterial bypass grafting. Don't quote me, something like that stands for. He was waiting for the procedure, and there was no ICU space. And he also had some leg issues. His legs were not functional, and he thought that getting the surgery on his heart would somehow make his legs work again. So he was really looking for it. He was very depressed about the fact that it kept getting postponed and everything. I went home and I read everything about not coronary, or on congestive heart failure. I was ready to come back and basically institute treatment. And I came and I did not see his bed. I didn't see him on his bed at the ward. So I was excited. Let me tell you why I was excited, because I say, oh my God, this guy, I've been waiting for the surgery for 2 weeks, and it must be that finally he got the surgery. So I was excited, and I went to the ward sister, and I asked her, did Mr. So and so get the surgery? And she said, Mr. So what bed? I told her the bed. Oh, he died this morning. And I was I broke down right there. I went back to my colleagues, and I just and in that moment I felt like I was such a failure, because I felt like I
Mhm.
was too late. I felt like maybe I could have done something to save him. I don't know. And I was just convinced that I was not gonna come back. And but it was when I spoke to other medical students, my senior colleagues, they said like this is not the first time it's gonna happen, and everybody has that first experience of the patient dying, and will feel that kind of emptiness, but try to use it to propel you forward, so that you try to get to a point where you say, I want to be the kind of person that does not allow people to die on my shoulders. So I want to help save people's lives. And I basically had to use that as a motivation to come back the next day, get my new patient, and just try to be more meticulous and that kind of stuff. So I know, sorry, my story was kind of long, but we all go through that experience of really feeling like, boy, this medical dental school thing is just not for me.
Mm-hmm.
Um, yeah, so there is actually a really important part of this conversation. I know what we've been talking about has been kind of sad at the same time, but there are moments there are moments that you see that really make medicine meaningful. But yeah, so what I wanted to touch on as well is your mental health, right? Medicine is a lot. You'll find yourself in situations like ones that we've just discussed, where you'll have moments where you second guess yourself,
Mm-hmm.
and you really take things hard. You There are certain things that will hit you really hard, like again, like your first patient dying, right? So, like, throughout all of this, just make sure that as you're going through medical school, that you prioritize your mental health. Let me tell you this, right? There is no way you will not be able to function properly. You won't be able to do what you need to do if your head is not in the right frame of mind.
Mm-hmm.
If your headspace not there, right? So it is up to you, right? And you have to take the responsibility on yourself, right? Because everybody, you have friends that check in on but it's up to you to kind of recognize when you just need to step back, and just take a breather, when you just need to step back and just recuperate. Like, this study, if you don't feel like study, right? If the energy isn't there, if you're just not feeling it, like if you're feeling overwhelmed, take time to breathe,
Yeah.
right? You
It
will
won't
not be the
stay.
best medical student you can be if like if you don't prioritize your mental health,
Mm-hmm.
right? With that being said, if you find that medicine, right, that coming back to the topic, if you find that medicine takes too much, like it takes too much of a toll on you, like for instance, you can't stand like it take like when I mean take a toll on you, I mean like you're completely depressed because of what you're seeing. Let's be honest, during COVID right now, a lot of death is happening, right? That's another thing. Like if you feel that you cannot man, and it's okay, no, it's okay. We're all different, right? We're all built differently, right? All of us aren't meant for medicine, and that's okay. There is
Yeah.
something else meant for you, right? That's okay. If you don't complete medical school or you leave medical school, you're not a failure. In fact, I commend you, right? Because it takes a level of self-awareness to recognize what's best for you, right?
Mm-hmm.
So I think it's, guys, I cannot stress this enough. I cannot stress this enough. If you need to take time off, if you need to just step away, do not drive yourself in the ground trying to pass these courses or trying to get straight A's, trying to be this model student. It's okay if you're not feeling up to it. It's okay if it's not working out. It's okay, right? You just need to take time, go back to the drawing board and wheel and come again,
Yeah.
right? You're not a failure for acknowledging that. um I think there's strength in that. As I said, it takes a level of self-awareness and strength to acknowledge that you're vulnerable to certain things, right? So please, 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 yeah.
And there will be a lot of external factors that will try to break your mind. So, for instance, when you get to the clinical stage, you're going to have your facilitators, your mentors, your seniors. They're going to criticize you, and you have to learn to take that criticism, take that advice, and learn from it rather than beat yourself up about it. It's not always going to be perfect, and don't allow that to crack you and just throw you off completely. No. You might be thrown off because you're human. You want to be the best, you want to do the best. But try not to overanalyze and stress yourself out. It's going
Mhm.
to happen. Expect it, learn from it, and keep going.
For sure. You definitely can't take things personal in medicine and dentistry. Let me tell you.
Mm-mm.
There are going to be times when you get a little dissing and you just have to take the dissing, right? You
Yeah.
feel disrespectful, you feel disrespected, you feel away. Everybody isn't nice. Everybody not going butter it up for you. And that's just facts. And you have to learn not to take everything personal.
I don't know if it's
So
a rite of passage, but I don't know why the doctors
listen.
think they need to be mean, but it's going to happen, guys. It's going to
Listen.
happen. And you have to just take it, swallow it, move on.
That is actually so true. And the last thing I would say is that, I mean, in terms of the pressure, it really doesn't get better, because the closer you get to the finish line is the greater the expectations are going to be of you. I mean, if you're on ward rounds, the senior student is expected to be at the level of an intern, whether you just start final year or you're a month away from a final MBBS. They put that pressure on you because they don't want you to become complacent. And I think, regardless of, I mean, we could all sit here and talk about how things need to change, and maybe our consultants can be a little kinder. You will meet some very nice and very kind consultants and residents, but you will also meet those who, they're not into the fun and games. You need to get to work. You need to do what you have to do, because they want you to know that, okay, this is serious business, and you need to get down to business and get it done. And so that is really normal, and you just really, it's best way to put it is medical and dental school is not for the faint hearted. It's not.
It is not. And I don't want to forget to mention this. I know we all came here as A students, honor students, valedictorians, solid guys. When you come here, you're all on one level. Nobody is gonna, and trust me, you're going to see some grades you've probably never seen in your life. And that is okay. It's okay to fail. Learn from your failure. And as Xavier had mentioned, it is okay to not know something and it's okay to be wrong. I think one of your biggest strengths as a medical or dental student is to learn to accept failure and learn to admit when you're wrong. If you're the type of person that don't want to be wrong, you're always right, it's going to be a very, very, very sticky journey for you because that's
Mm,
not the case. You're not always right and you are going to be wrong. And knowing where you went wrong is what will make you a better dentist and a better doctor. If you have this mind block towards what you're learning, what they're telling you that is wrong, you'll never be able to correct that mistake. You have to open up your mind to
mhm.
the fact that I made this mistake. Let me go back, see what I did wrong, and better myself as a physician. So, guys, that's my tip there.
For sure. For sure. So even the first part, like, oh, and I know we're going a little over time, but even for the first part where I said, where I mentioned um the transition,
Mhm.
the transition from high school, guys, from high school to medicine, it is a lot, right? And it's
I compare
it's
it to GSAT to CAPE. Just imagine
yeah,
going from doing a
it's
GSAT exam, your what do you call it in other Caribbean countries? Your grade six,
The
your
same
sixth
thing.
your
grade to
Yes.
your
Yeah, either
after
they
high
your
school.
pep
Like,
pep pep pep
right. So
pep.
Jamaican say PEP, and then some countries have GSAT, other countries have common entrance. Same thing.
it's
Grade
like
six.
that straight up to right before university.
Yeah, yeah. Right, guys. So take you see everything what Jada said. Just try to take it all in because it's very true. Like honestly, you're going to see a C and be grateful. Let me tell you, I'm sorry, but I'm just speaking like it's a lot, right? It's a lot, and it's okay. Like let me tell you this. Let me tell you this. You see the C student and the A student, you're both going to be doctors. You're both going to graduate. Nobody now come in your office and ask you, did you get C's in your junior surgery rotation? Did you get a C in mole med? I'm leaving. No, it will never be that scenario, right? So again, failure is going to happen, right? Okay, let me not, I'm not, don't receive it, don't
Don't
receive
scare
it,
me.
don't receive it, but it might happen, right? It might happen.
Mhm.
Again, this is quiet the transition, as I said. It might happen, it can happen, it does happen. But that's okay. Honestly, no one is judging you. Like if you fail, I saw it goes med school, it rough and it tough and everybody knows. So as Jada said, guys, and Xavier mentioned, like you will not always be right, and you just can't. The feelings thing, right? Don't take it personal. If you're wrong, and that's okay. In fact, you're more likely to remember something if you got it wrong the first time. Like
Mhm.
if you don't know it, you're like,
That's so
oh,
true.
okay, that makes sense, right? So
Mhm.
it's okay. It's life. This is just going to be the rest of your life, right? Even as
Mhm.
an intern, I remember Dr. Paul, who was our previous dean. He shared with me, right? Because remember, you have to do licensing exams. To continue medicine every couple of years, right? Because again, as we mentioned before, medicine is ever changing, ever revolutionizing, or ever yeah,
We get it.
evolving. That's the word. Evolving, right? Evolving, right? And he told me Dr. Paul is brilliant, right? He told me that he actually failed a licensing exam, right?
Yeah.
And he's just like, that's okay, it's a part of life. And this wasn't when he was young either. This was when he was a physician, like just a couple years ago when he had to renew his license as a physician, right? So it happens to everybody. It happens all the time. It's a part of life, right? And at the end, honestly, it's what you do. Like it's what comes out of that failure, right? Every time you fail, it's a chance to learn something. Like that's an opportunity to say, okay, maybe I shouldn't have gone about it that way. Maybe this studying technique just isn't working. So
Mhm.
it's a chance for you to reflect and then come again. So that's that. I think I'm going to end here. But guys,
Oh my God.
this is a I think it's a wonderful journey, and you're going to learn a lot about yourself
Yep.
as you go through the process. And we're all at the, well, most of us are at the, you know what? Let me not put age into this. But as I was saying, this is the period of time in your life where you'll be figuring out who you are as you face certain situations, right? So just as you go through it with grace, give yourself grace, be kind to yourself, right? And just, you can do it, guys. You can do it. You can do it. You can do it. You can do it.
Thank you so much for that. I know, I mean, we went over the time that we had prescribed, but I think it was important for us to complete the conversation because, I mean, we could go on and on and on. And I think, tell me in the comment section, do you think we should have another session to wrap this up another day? Let us do the session. Obviously, as you know, all good things must come to an end. And I want to thank you, Jada, and thank you, Sienna, for this wonderful discussion. And I want to give you a last opportunity to say some last words as we wrap up this session. So we can start with you, Sienna.
All right. I thought I gave my last words already, but I'll go again. So yes, guys, the key things that I want you to remember is to prioritize your mental health. As I said before, that is key. Unfortunately, it's not something that they're going to address in school, right? It's something that you're going to have to sometimes deal with on your own. Some of you, when it comes to the top, some of you might be living on hall, you might be away from family, stuff like that. Everything might be overwhelming, but please just do what you need to do. Do what you need to do. Do what's best for you to ensure that you're able to produce quality. You're able to be the best student that you can be, right? So those are my few words. And go forth and be great, y'all. Go forth and be great.
Thank you so much, Sienna. And Jada, to you, what are your closing remarks?
Okay, there's something I came across and I've been living on it forever since I came across it. Yeah. So whether you like it or not, failure is a necessary stepping stone to achieving your dreams. Failure should be our teacher and not our undertaker. Failure is a delay, not a defeat, and it's a temporary detour. It is not a dead end. Remember that all the great inventions, a lot of them were made after failing something else. So don't ever give up after failing. And I am already super proud of all of you guys. I'm looking forward to meeting all these future doctors, all these future dentists, and I'm hoping that we'll meet along the way. I'll be able to say, hey, I know Dr. Let me call him. I can't pronounce. I know Dr. Christian Jr. Hey, Dr. Ramlal. I'm really looking forward to meeting you guys. Really looking forward to seeing your little journeys. And yeah, nice to meet you all. Jada out.
Thank you so much, Jada and Sienna. I really appreciate the discussion, and by the looks of it, the people in our comment section, they've been sending their thanks, and we just really appreciate you for taking your time off I mean, Sienna, she is actually in fourth year. That means she is in school. She has a clinical stuff going on, but she took her time off to come here. Jada, Jada is a dentistry student, so that means she's
always in school.
So that means she have nothing called summer. Her last summer was just before she entered medical school. So that means it is a sacrifice, and they've taken this time. And so we just want to say thank you on behalf of HyperAcademics Jamaica Limited, and also thank you on behalf of the students who have watched this, who have been with us, and of course many of them are going to watch this after. So just want to thank you. Thank you very much. So guys, this was a wonderful session. I'm still high off it. As you can still see, it is still on the screen. One of the key take homes from both of them, both Jada and Sienna, stressed on it, that failure is part of the process, and failure is a necessary stepping stone. So I really hope that you really appreciated this session. as the individuals took their time off to really come on here and ensure that they can give you the nuggets of wisdom that I keep saying all through MedSkool KickOff. I wish that I had some of the good nuggets that have been coming out of these sessions. So without further ado, we're going to transition into the second aspect of our MedSkool KickOff. We should still be right on time to end within the next 45 to 50 minutes. And so what we're going to transition into right now is a program or a session that is organized or led by the University of the West Indies Surgical Society. We have Xavier Brown, the big head guy who came and spoke to you all yesterday. He doesn't need a second introduction except to say that he is rather the immediate past University of the West Indies Surgical Society president. So good for him on that one. And then, but first we're gonna start with a young man by the name of Simon Scully. Simon Scully is just wrapping up his first year of medical school. He's transitioning into his second year of medical school. Simon is a bright young man. Listen, the sun don't have nothing on him. He just bright like that. But also he's a very humble young man, and he has a passion for helping students. It has come up all through. I've been monitoring and watching him as a student over the last academic year. And as HyperAcademics, we realized that, boy, we cannot go on to the next academic year without bringing Simon Scully on board, because he's both intelligent and also he's passionate about helping persons. And so nobody is better to come on here at MedSkool KickOff to help you understand what it is like to be a medical student. And so what he's going to do is that he's going to introduce his organization to us at the University of the West Indies Surgical Society. And he's also going to just tell us of his own experience with UWIS. And I'm sure somewhere in there is going to come up how exactly, he navigated the space. So without further ado, I'm going to invite Simon Scully to tell us about the University of the West Indies Surgical Society.
Good afternoon, class of 2K26. Thank you, Devon. I don't know about you guys, but I definitely enjoyed the session by Jada and Sienna. Once again, my name is Simon Scully, and I'm a second-year medical student, tutor at HyperAcademics, and vice president of UWIS for Year 1 Affairs. You may or may not have seen me in day 1 of the MedSkool KickOff, but I'm here again today to speak further about UWIS for those who are still confused or don't know about it. So UWIS is a nonprofit organization that basically offers anatomy tutoring on Thursday afternoons. We're currently gathering a group of second years who just finished anatomy and that are capable and willing to teach you guys how to navigate through the course, because it can be difficult going into it with no prior experience. Imagine walking into an exam and just staring at a cadaver, not knowing what to do. I urge you guys to give UWIS a try, because you can always back out later if you'd like. UWIS also offers practice spotters, which are basically exam practice, among many other things, which I'll get into in a bit. Yep. And on the next slide, you guys should see a picture of a couple members from the former executive committee on the sides. From their smiles on their faces, I'm sure you can tell that this is a welcoming organization that really wants to help you guys succeed. If you look towards the right, you may see a familiar face who you will be seeing a lot of over the next year, teaching at HyperAcademics, specifically embryology, Dr. Xavier Brown, holding up his hand. We can back to the next slide. This is the new executive committee for this year, 2021 to 2022. Unfortunately, due to COVID restrictions, we haven't been able to meet up to take a group photo, but I assure you that we will, and that when we do, they'll be posted on our Instagram and Twitter, so please make sure you follow us over there. I'll post the link in the group, the 2K26 group, so you guys can use that to get there. Gordon Foster and Sina Reddy, the head of anatomy and deputy head of anatomy, over the past 2 weeks have been interviewing past medical students that apply to become tutors for you guys. Ulrika Brown, our president, and Janelle Cripps, head of IT, and Savannah Miller, who is our vice president for Year 2 Affairs, which you can see in the next slide in the pictures, have been working tirelessly to organize the PowerPoints and other materials that are needed for the classes. You may not have seen them, but they are working behind the scenes along with the rest of the team because we want you guys to do well. And on the slide after, you may see a list of tutors that we have compiled so far. Right there, yep. Each group will consist of 2 tutors and 4 to 5 students, and classes will be conducted every Thursday. All of these students have earned at least a B+ in anatomy and have all the tips and tricks ready to share with you guys for every class. You may or may not recognize some of the names on the list. My name is in the bottom right, tutoring some of you, which may be very, very fun. And on the next slide, we should see some FAQ questions that I saw some of you submitted on the Google form that I sent to the group. How do I become a member? Well, over the past 2 weeks, I posted in the group several times with the registration form. It's basically a Google form where you enter your name and other information. After that, your information gets put in an Excel spreadsheet where we are currently allocating which students go under which tutors. In the week of September 6th, I'll make another announcement indicating what group you've been placed in and when the next class will be and how you'll be able to access all of that. So don't you worry about that. All of these questions and answers will be posted in the group as well in an FAQ document summarized. The next question is, how do you access tutoring this semester? Well, basically, we will be having the sessions on Microsoft Teams, which you can download on your computer or your phone. All you need is to pull it up on the day, and then you'll be able to watch all the classes. What else does US have to offer? Actually, we're going to come back to that question. We're going to skip to the question after that. I'm not a medical student. Can I still register? Yes, you can. US currently, mainly caters to the students of the medical sciences faculty and the sci-tech faculty. But we also allow students from other faculties as well to join. Once you have an interest, you can just put your name in the application form, and then we'll be glad to accept you to the team. What else does US have to offer? In the next slide, you can see a ton of events that we had in the past year. First of all, we had, as you can see in the top left, an ENT surgeon, and in the bottom middle, a medical intern come in and speak about a day in their lives. It basically lasts around 1 hour, 2 hour, and they're very interesting, especially if that's something you want to specialize in the future. On the top in the middle, you can see even some of our former executive members have some sessions, Xavier Brown and Dominic Samuels, on the evolution of surgery, which was very interesting if you're able to make it. You were able to make it. On the right, you can see we had some Twitter discussions as well. And in the bottom left corner, you can see that we had a radiology seminar on the cardiovascular and respiratory system. It's for those of you who are planning on going to the US or writing the USMLE, this is a great introduction on radiology. Yep, and that will be it for that slide. And then we're going to move on to more FAQs. So can I switch tutors? That's the next question that I saw a lot of you put in. So after the first class, which will again be in maybe the week of September 12th, during that week, we will have send out a Google form after the first class where you can talk about how you felt the class went. Did you enjoy it? And if you want to switch tutors or not. I urge you guys to at least stick around for like 2 classes at least to get really a feel of your tutors before you actually make a switch. But you can do whatever you like as long as you indicate that in the form that we'll send out after the class. What do I bring to the sessions? All you'd need is basically a device, whether that's a computer or a phone, to watch the session with the Microsoft Teams downloaded, and a notebook to make notes, or even an iPad if you have that would be great, and an atlas so you can follow along with the tutors as they go through the different muscle groups, nerves, and blood supplies. How long does each session last? Well, each session lasts normally around 2 hours, Thursdays from 2 to 4. However, sometimes the tutors may get a bit more specific, go a bit slower, get a bit more in detail, and they may stretch to 3 hours, but don't you worry. All the sessions will be recorded so you can access them later if you aren't able to make it or you have to leave for whatever reason. Can first-year applicants gain positions? Yes, they can. We're currently looking for a first-year representative, which will have the role of basically making announcements to the group and other things, which I'll specify in the group as well. I'll also provide more information about that in the WhatsApp group a little bit later. All right. Thank you all for listening. I hope you give US a try. If there are any more questions, please feel free to message me wherever and whenever. You will be seeing me in the group chats making more posts today and also at HyperAcademics when I tutor over there as well. I've already spoken to a lot of students who had questions about US, and I welcome more of you to continue to do so. I'll now hand over to Dr. Brown, who will give you a little anatomy introduction, starting with the clavicle.
Well, just before Xavier comes on, Simon, if you don't mind, I want to ask you, how has US benefited you in your first year? Because I mean, you just came in, you're entering your second year. That means you've been with US as a student, and in your second year, you've risen to the position of vice president. Has it been beneficial to you in any way?
US has been a huge impact in my med school career. Starting off in the first week, I was not able to make as many friends as I would have liked. But when I went to my first session, I had some really great tutors who not only taught us the content very well, but also forced us to interact with them and forced us to interact with other students as well in the group. So I was able to make friends there as well. And I was able to just blow up from there. And on my anatomy exam, using all the tips and tricks that my tutors taught me, all the videos they spent time making, and all the animation they spent time showing us, and all the resources, I was able to do very well on my exam and on my spotter as well. So
thank you very much for that. And the last question is, I noticed that it's not University of the West Indies Mona Surgical Society, but University of the West Indies. And you know, we're all about regionalism here at Hypr and at MedSkool KickOff. So does that mean that we can expect that you would entertain KVille students and St. Augustine students who are interested in working with US as well? Because I think it came off in the day one that at those campuses as well, on Thursdays, they also have half day. So can KVille and St. Augustine people be accommodated with your programs?
Definitely. Well, we are now online, because of COVID. So we are very open to accepting anybody as long as they put in their application. But yeah, you're right. It doesn't say Mona, so we are definitely open.
And here's what HyperAcademics is going to be that bridge between US and the other campuses, and definitely as soon as MedSkool KickOff is done, we're going to have conversation with the MSAs at those campuses to see how it is that we can get US integrated, especially since COVID-19 has presented the opportunity for us to engage on a virtual space. Thank you so much, Simon, for introducing US to us. We appreciate the work that you've already done, and we look forward to what you will do with Hypr as well as with US. And we also wish you all the best in your medical school career.
Thank you very much, Devon.
So at this point, I'm going to invite Xavier Brown, who is going to take us through our academic session for today. He did a kind of a good job yesterday. I don't think it was, I'm just joking. He did an excellent job, except for that time when he used me as an example. I'm still going to take him to court tomorrow. But for now, we're going to turn over to Xavier. Again, we will not see him which is probably a good thing. Okay, I need to chill. But without further ado, let me invite Xavier Brown to take us through Locomotor. But Xavier, don't forget, you have that icebreaker that you have to share with the students, because
right.
I actually I announced it earlier today when we started, and I was a bit flustered because of the thunder and the lightning that were flashing. I was a little scared, so it made me a little flustered. But yeah, definitely. So let's go.
So hey guys, you guys should be able to hear me. So just a quick question, which is a very common question actually on your spot on. So who wants to give this a guess? So this is a clavicle. I hope you knew that. Who wants to tell me if this is a left clavicle or the right clavicle? So just send your responses.
Okay, remember there's a slight delay with the responses coming up here. So yeah, see them coming in now.
Right, I'm seeing them. So I'm seeing a lot of lefts. I'm seeing a right. Okay. Anyone else? Okay, guys, so this is actually your right clavicle. This is actually your right clavicle, guys. So let's get moving. So this is the last session that we'll be having today from me before I'm actually fired from HyperAcademics. So today we're going to be discussing locomotor. Now, for many of you guys, especially if it is that you're transitioning from high school, anatomy is something that's going to be very much new to you, which is why it is that we ensure that you had an introduction to UX before this, because these are going to be the same individuals that are going to actually guide you through anatomy. This is not something you've ever done before, if it is that you're coming directly from a high school. So, and nothing exhaustive, it's just to give you a little bit of a head start before you start med school next Monday, I believe. Now, it would be only fair in a discussion of locomotor to describe or define what it is that we describe as the anatomical position. Now, the anatomical position is a universal position. That's the first thing you need to understand. And why this is important is because Jamaica, Trinidad, Barbados, Caribbean, the US, Canada aren't the only countries in the world with doctors, and we don't all speak the same languages. And therefore, anatomy, especially the anatomical position, is where it is that all of this comes together. Because if it is that I was working in Italy and I'm calling Simon or Mark or Angelique over here in the Caribbean, and I want to describe what's going on with a patient, the patient could be on his back in Italy, but I have to be able to, while using the anatomical position, describe where exactly something is on the patient, right? So that's why it is that I said, irrespective of where you are in the world, the anatomical position remains constant. So on the screen here, you're actually seeing the anatomical position. What you realize is that the patient is either lying down or standing up directly in front of you. So they're facing you. You realize that the arms are by the hip. You realize that the palms of the hands are facing towards you. You realize that the feet are also directed straight towards you in both the male and the female. So this is what it is that we describe as the anatomical position. When it is that you reach clinical years and you have to examine a patient, this is the first thing that you have to do to the patient. You have to place the patient in the anatomical position before you comment on anything on the patient. Does everybody understand that? And yes, you guys will learn how to differentiate between the clavicle. Is everyone okay with anatomical plane? Excellent. So we're then going to have a discussion of anatomical planes. So this essentially describes different cuts that we can actually make through persons. And don't worry, this is the boring part of anatomy to me. This is like the basic term stuff. So there are many cuts that we can make in an individual. To me, the easiest cut that you can make in someone, and this is a plane by the way, is a horizontal cut, right? So we cut through the patient like that. And we describe that as the horizontal plane. If you realize it divides the patient into an upper half, which we see here, and a lower half, you realize that these two halves don't look the same because this is a person's upper body up here, and this is the person's lower body. Another cut that we can make is the sagittal plane. Now, the sagittal plane is a cut that's made like this, right? Like this. So you're cutting the person in two equal halves. So you realize that the right arm is on one side, the left arm is on the next side, the right leg is on one side, the left leg is on the next side. So you're cutting through the patient just like that. The frontal plane, and very rarely will you see it be described as the frontal plane, but it will be described as the coronal plane. It's a cut that's made like this, which basically divides this person into a front half and a back half. An excellent mark, right? So in the sagittal plane, we cut the patient along his midline. So these are three different planes that we can divide an individual in. A sagittal plane, where we cut the patient, and I'm not talking about surgical cut, by the way, just planes in general. We cut the patient along their midline. We can cut the patient transversely or horizontally, or we may cut them into a front half or a back half. Excellent. So the next thing, and what this really emphasized was how exactly it is that we're able to actually describe the sutures of the skull. So sutures would be where two bones of the skull actually meet. And you'd realize that this suture that lies right here, we call it the sagittal suture. And it's because it lies within the midline of the individual. So that's why we call it the sagittal suture, because it lines up with the sagittal plane. And you realize that right here, and we said this plane, how does this plane cut the individual? Into what kind of halves? Right, front and back, essentially, right? We call it the coronal plane, right? So easy stuff, just little terms, you go in, you surprise your lecturers and how you know this already. So one other thing is understanding anatomical movements. And yes, anterior and posterior halves, right? So understanding anatomical movement. Now, the simplest anatomical movement that you can kind of make, or the simplest one that you can understand, is flexion and extension. Now, I'm not going to get into how every single joint is able to flex or extend, but the concept behind flexion and extension is that with flexion, what you realize is that you have a decrease in the angle, and with extension, you have an increase in the angle. And the simplest joint to actually demonstrate that in is the elbow joint, right? So this is the arm. So let us ignore the shoulder joint because it will confuse you if you're not used to it. So if it is that I have flexed my elbow, you'd realize that your arm would lie like this, and you can actually bring it up even more, right? If I've extended my elbow, you'd realize that my arm will be lying more within this plane. Now, each joint, you kind of have to go through and understand how exactly it is that flexion occurs at that joint or extension. So, for example, you realize that in this image, it is demonstrating shoulder, the shoulder joint flexion and extension, in which flexion brought the shoulder joint in this direction and extension brought the shoulder joint back here. If it is that I were to flex at the hip joint, you'd realize that flexion would occur, you'd realize that flexion would occur in this plane. One second, guys, it's giving a bit of problems. All right, let's focus on what we have here. So if it is that I were to flex at the knee joint, you realize that the knee and the leg moves backwards, right? And when it is that and I'm extending it, you realize that the knee joint moves forward. Does everyone understand that? All right, excellent, excellent, excellent. So there are a few more anatomical movements that we can get through. We have abduction as well as adduction, as we see here, and we have lateral rotation and medial rotation. Now, these two words that you see here have actually been butchered by doctors for decades. Now, adduction, we don't really call it, because adduction and abduction sound pretty much the same. You will always hear your lecturers and other doctors say a deduction and a abduction. So I'm just going to put that out from now. When it is that you're saying these words, unless it is that you're very clear with your speech, then you can say, yeah, man, adduction and abduction. But you can realize that when it is that you want to be very clear as to what's going on, then you'd be like abduction and a deduction. Now, if it is that you're adducting something, you're adding it to the body. So you see the arm right here, you realize that it lies like this. Now, if it is that you're adding it to the body, then you're bringing it to the midline. So it's being added to the body. If you're abducting it, similar to as if an alien is taking you away, then you'd realize that you're bringing it away from the midline. So adduction and abduction, right? Medial rotation and lateral rotation. When you think about medial, think about the midline. So this is the midline of the individual, as everyone would know. So medial rotation means that you're moving the leg, you're rotating it towards the midline, and lateral rotation means that you're bringing it away from the midline, right? So we've learned about flexion, right? We're decreasing the angle, extension, so you can do it with your elbow joint, just as if you're curling, you're doing bicep curls, right? You're flexing, you're extending, right? Similar to the shoulder joint, you bring it up, you're flexing, you bring it behind you, you're extending. If it is that someone says, adduct your hand or adduct your arm, you're bringing it towards the side, towards the midline. If you're abducting it, you're taking it away. If somebody say, medially rotate your shoulder joint, and you realize that you're doing an action similar to when Ding Dong says to fling his shoulder, right? And then laterally rotating is where it is that you're going to be rotating that shoulder joint or any joint that's able to do that movement away from the midline. Is that clear for everyone? Excellent. So just a few more. I believe these are probably the last step before we get into some exciting clinical stuff. Because I'm not a fan of basic medical science. I know it, but it's not very exciting because it's just words that you just pick up as you move through the field. So Here it is that we have another one, pronation and supination. Now, every medical student who has been to at least one medical class can tell you the difference between pronation and supination. Because everybody remembers that supination is like when it is that you're holding a bowl of soup. So when you hold a bowl of soup, you realize that it's on the palm of your hand. So if somebody says supinate your forearm, you're going to realize that the palm of your hand is now facing your face. So you think about it. Supination is like a bowl of soup. The opposite of supination is pronation, which is what it is that you see here. So you realize that this is supination. That's what you see here. And you have pronation. Now, another one you have is dorsiflexion and plantar flexion. The dorsum of your foot is at the top of your foot, right here. And when it is that you want to plant your foot before you run off, it's at the bottom of your foot, right there. So if somebody says to plantar flex, it's similar to if it is that you're pressing the gas pedal in your car. So when it is that you get into your car, or even if you're in the driver's seat or the back seat, and you're pretending like you're driving because you don't have your license yet, then you can plantar flex your foot so that you can accelerate the car, right? And then your dorsiflex would be the opposite of it because you're now bringing the dorsum of the foot up towards your shin. Another one you have is inversion and eversion. That's simple stuff. Inversion means you're bringing it to the midline. Like here, you see it swinging like this. And eversion, you're bringing it away from the midline. You see it move out like this. The other words are just common sense things. So protraction of the mandible, meaning you're moving it outwards. And retraction means you're bringing it back. Elevation means you're closing your mouth, like this, elevation of the mandible. And depression means you open it, right? And then you have opposition. And that's normally when we're talking about opposition, is when it is that we bring this pinky finger towards the thumb. You can use any other finger, but if someone says to oppose your pinky and your thumb, you realize that they're going to meet like that, and we call it opposition. Everybody clear with that? Some easy terms. So you realize it's not that exciting. You just pick these things up and you just move on with life. Yes, Jada, you're learning it again. All right. So anatomical movements, see them all here: flexion, extension, adduction, abduction, lateral rotation, medial rotation, circumduction. Just mean you just like when people dirty whining or they're moving the arm around in that shoulder joint because they're just weird. Yeah, all of those things. These are all the movements that you guys should know. And the final boring topic before we get into some real clinical stuff is this. So if you remember, we were following the YouTube chat, you would have seen that Mark had actually mentioned something called, is it here? Oh, no, it isn't, but I'll bring it up. But what you see here is superior, which means going up, obviously. Inferior means going down. Laterally means you're going away from the body line. Medially means you're going towards the midline, right? I don't know what medial, all the way up there. Then proximal means, so for example, these are relative, these are, what you call it? These are like terms that you use relative to something, right? So if it is that I took a point, like say right here, and this is my wrist, right? My shoulder joint is proximal to my wrist, but my fingers are distal from my wrist, right? So the distal you can pretty much take as being away from it and or being downstream from it, and proximal being upstream from it. But again, it's something that is relative. So let us take something else, for example, right? I'm going to circle the knee joint right here. The hip joint is proximal or distal to my hip joint. The hip joint is proximal or distal to my knee joint? Again, is the hip joint proximal or distal to my knee joint? Right, excellent. Then, is my ankle joint proximal or distal to my knee joint? Which one will answer? Right, the ankle joint will be distal to my knee joint, right? And the hip joint will be proximal to my knee joint. Right, excellent, excellent. So you guys, these are easy stuff. So basically, you can skip the first session of US, but just do tell Simon. But that's what they're going to teach at the first session of US. So you can skip it. Don't waste your time. Take up the book and do something else. So anyways, let us get into some locomotor pathology. Right. So the most important thing to understand from locomotor pathology is the concept of nerve palsies. So you would always know that, you always hear a person say, oh, this, or when it is that you start med school, you'll hear that, oh, this nerve supplies this muscle, right? Or, so for example, you learn about a number of nerves, and I'm so serious. You're going to learn about nerves that supply some of your upper limb muscles, so your biceps, your triceps, your pronator teres, some long ones like your flexor digitorum superficialis. You're going to have a whole lot of muscles to learn. And all muscles are going to be innervated by a nerve. And nerves will, of course, supply multiple muscles for the most part. Some of them may only give sensory supply, which means feelings of more pain, temperature, etc. But you'll be learning about a whole lot of nerves. So when you think about nerve palsies, we realize that if we have damage or impairment of the supply for example, a particular muscle, then you realize that we're going to have particular issues. Is that understood? So as we said, nerve palsies is simply damage to a nerve that supplies a muscle. And therefore, if it is that the nerve itself is damaged, then you're going to have loss of function of that supplied muscle. So if it is that I say this particular nerve supplies the biceps, and the exact branch of the nerve that supplies the biceps is damaged, then you realize that you can't use the biceps again. Everybody understand that? Sorry for the bit of background noise, if you guys hear me. So, when it is that you begin medical school or dental school, you're going to, one of the first set of nerve plexuses that you're going to be introduced to is actually the brachial plexus, right? The brachial plexus is essentially, to keep it very simple, is this like these set of nerves that are going to be coming off the vertebrae by your neck. They go clump up underneath your armpit, where it is that you rub roll on or deodorant, and it's going to then just move out and shift out into your arm, giving off a whole lot of nerves that are going to supply all of the muscles. It can be very daunting initially, which is why you should join US and go to your lectures and read a book, but it's very simple. So one of the simplest diagrams you're going to find of is quote unquote brachial plexus, and remember that this only supplies your upper limb. You do have a plexus that supplies your lower limb, called the lumbosacral plexus. This is one of the simplest diagrams that you'll find. So you see something like this and say, maybe I can swap this little bit, roots, trunks, divisions, cords, branches, and you swap this off and you draw this in the middle of the night, which I can't do right now because I don't remember half of these things out of the top of my head. Then you go on and you take it a step further. You say, all right, I want to see what these nerves probably look like. So you find this colored photograph online and you say, oh, this looks like MedSkool. No, it's no longer lines anymore. It's nerves, and I can see things coming off of things, bag of excitement. Right? So it's same brachial plexus that you're going to learn about when it is at your start. Right? And this just highlights, how it is that it comes off the neck right there and it moves underneath your arm, and then all of these nerves branch out and separate. So you would there feel very smart, never got any US, never got any locomotor classes, never read a book, never care about anything. And then you go into your spotter and you see this and you're confused. And sometimes it's not as pretty as this because I just couldn't find one of the US specimen because it's been a while. Because this is one of the cleanest cadavers, as she said, that I could find on the internet. But in truth, when it is that I had to do physical spotters, it was literally like dropping a bunch of ramen noodles in a bowl, and they just drop a pin in there and they'd say, which nerve is this? So it takes a lot of practice, right? Which is why we say, you're going to have to dedicate time to actually studying to be able to pick up landmarks really quickly. And then trust me, once you catch it, you have it forever. I mean, you forget it a little bit and then you go back to it and read it for 5 minutes and you'll remember. But the key thing is practice, practice, practice. So you realize that there are lots of nerves coming off of it. For example, you see MC right here. That's a musculocutaneous nerve. Yeah, you see R right here. Some of you would have known your radial nerve, right? Ulnar nerve right here, axillary nerve. But don't be daunted by anatomy. Some persons will catch anatomy before you, but it doesn't mean that you can't catch it. I wasn't the biggest fan of anatomy in first year, but I really love anatomy now, right? So you'll be fine. So you see these different nerves. They always tell you that, you see that ulnar nerve, any of you have ever hit your funny bone, like right there on the medial, you guys should know what medial is now, on the medial aspect of your elbow, and you feel like your arm something just shock you. Have you ever felt that way? You hit the medial side of your elbow. You just passing something and it bounces it. Right, the medial epicondyle, right. That's exactly where it is that your ulnar nerve run. And it's a very superficial nerve at that point in its anatomical course. So when you knock the nerve directly, you're going to, of course, feel like something shock you, right? So anytime you hit your elbow again and you feel it, say, yeah, man, that's my ulnar nerve, right? So this is how you can remember some of these things. So let's get into some clinical scenarios of these nerves. So here it is that we have a baby. Again, let's give him a name. What should I name him? Devon, right? So based on the size of the head, we can say that this is Devon, right? And it so happens that Devon has very wide shoulders. Now you see when Devon is coming out, and you realize that I haven't highlighted that. Remember how it is that I said the brachial plexus, which is right here, run from your neck and it run underneath your arm and it will give off a whole bag of branches to supply your arm. I mean, if it is that they go fire, it's better go to that bargain, right? So here it is that we have Devon again, and he has very wide shoulders, right? Now, as it is that Devon is passing through the birth canal, it so happens that his shoulder buck up right here on this bone, right? Part of the pelvic bone. And inexperienced doctor never ever really realize what's happening. You just feel like the baby fighting him back. So guess what him do? Him pull. And him pull until finally the baby come out. Right? Now, when the baby comes out, the baby is crying, the baby is in pain, and the baby has his hand just like this. Right? The baby has his hand like this. You realize that it's the shoulder joint is internally rotated, right? You realize that the wrist is flexed, right? You realize that the forearm is pronated, right? So the forearm is pronated, the wrist is flexed, the shoulder joint is internally rotated, and all of this excitement, and the baby is in pain. Poor Devon, right? What has happened is that remember the same brachial plexus that I showed you up here, there's a point right here. Herb's point at the junction of C5 and C6. And when it is that we pull the baby, not we, because I'm not giving those kind of problems, but when it is that those physicians pulled out the baby, they damaged Herb's point. And the name of that deformity, because based on the muscles that would be supplied coming from those roots,
connection and power supply.
But based on the muscles that would have been supplied from those roots, they're going to be impaired. So and the name of it is called Herb's palsy. So when it is that you see a baby or anybody like this, they call it Herb's palsy. Another name for it is waiter's tip. And what it reminds them of, why it is that they call it waiter's tip, is because it's almost as if a waiter is secretly taking a tip, because the boss, they don't want the boss to them, is secretly taking a tip from a customer. There are two names for it, Herb's palsy or waiter's tip. The position is called the waiter's tip. Excitement. It can also happen to you in adulthood. If you experience some damage to Herb's point by doing whatever it is that you're doing, and you end up looking like this. So you can see why, again, we call this waiter's tip. So here's Devon again. So you remember how yesterday Devon went to Shensia's house? Well, after it is that we treated him for that inflammatory response that we saw yesterday, we gave him some antihistamines, we gave him some pain medication and all of that. He decided to go back to Shensia's house, right? He made sure that the wasp nest wasn't there, and he climbed the fence, and on his way up, he had to climb a tree to get to the window. Now, what happened is that he didn't realize that that limb wasn't really a sturdy limb. And you know what happened? He lost his balance on that limb and caught onto a next limb. And you know what happened? The same brachial plexus that we had coming from the neck right there, this time he ended up damaging this junction at C8, C1. And when it is that Devon comes back to us yet again, I don't know why it is that he don't leave this girl alone, right? He comes back to us and his hand looks like this. He has what we call a claw hand, just like this, hand stuck like this, because I'm going to climb tree and tear out his brachial plexus, right? So the name of this, I mean, you can call the deformity a claw hand deformity, but the name of this palsy is what we call Klumpke's palsy. Realize that it can occur at childbirth as well. If it is that you're just pulling the baby by the hand, again, it can happen. But the more interesting case is someone hanging off a cliff, right? Or hanging off something. Which is too nice. Right. So it so happens that one day, even with his little claw hand there, he finally gets with Shensia, right? And they got married and they're chilling on their honeymoon. And see them here lying down like this. Again, Devon, Shensia. And you realize that Shensia's head is lying right there, probably a bit closer, but lying right there under Devon's armpit. And before the night ends, both of them fall asleep and Devon wakes up. And when Devon wakes up, he realizes, let me clear this, that his hand looks like this. So he has what we call a wrist drop. So what happened was that with all of that lying down and all the slackness that they were doing on their honeymoon, he actually compressed his radial nerve for a very long while. And because the radial nerve actually supplies the extensor muscles of the forearm, which allow you to extend your wrist, he can't extend his wrist. So he shows up like this with a wrist drop. So they actually call that, some of them will call it honeymoon's palsy or honeymoon syndrome. But another scenario in which this same thing can happen, and the one that they're more than likely, but they can put both of them in the exam, is Saturday night palsy, which is the same thing, right? So Devon gets a bit older, realize that him don't like Shensia anymore, him go out, him go have too many drinks, right? Go cheat on poor Shensia after him run down the girl, and come back home and drunk, man, you know, fall asleep on the back of the chair with his arm over the back of the chair. And you know, when it is that you're drunk, you're not waking up till hours after. So you know it's a good sleep Devon getting, right? So it's the same thing that ends up happening. You have compression of your radial nerve, and he shows up the next day with his cheating friend. Both of them go out and cheat with the same wrist drop that we see right here. And it's because of compression of the radial nerve. So we've spoken about Erb's palsy, right? Which we say is the upper trunk of the brachial plexus. We've spoken about Klumpke's palsy, right? Which is the lower trunk. And we've spoken about Saturday night or honeymoon palsy. So the final one, and this is the last time we'll be hearing from you, because Devon is about to fire me, is this. So this is a very common exam question, actually. And what it is that's demonstrated here is that you realize that the person is pushing against the wall, and you realize that the scapula is coming out at you. And there's a particular nerve, right? It's called winging of the scapula. There's a particular nerve on the brachial plexus that can be affected. See it right here. It's the big boy right here. A favorite nerve, well, in the upper limb. So the big boy right here, called the long thoracic nerve of Bell. Its roots being C6, C7, C8, or C5, C6, C7, if I remember well. One of them. Yeah, C5, C6, C7. Right? And what ends up happening is that when you have damage to that nerve for whatever reason, there's a muscle that it directly supplies, right? And it's serratus anterior. And when it is, the investigation that you do on the patient, really an examination that you do on this patient, is that you ask them to push against the wall. And on the affected side, you realize that you have winging of the scapula, right? So if the long thoracic nerve, as with this patient on the right-hand side, you realize that it's the right long thoracic nerve that's being affected. So thank you very much, guys. That's all I have to cover. with you guys, given the time.
Hi guys. Did you enjoy this academic session with Xavier? Let me know in the chat. Let us know in the chat. We want to know if you found this last academic session to be helpful at all. I mean, as you recognize, there is a full-on war between Xavier and I, because it is very clear that Xavier thinks I'm joking. He doesn't know that I have the best team of lawyers waiting for him, and he's so just unapologetically harassing my life. So I will have to consider litigation. And I think it's a very serious matter. Remember, I told you guys yesterday, you have to not be afraid to report abuse. And Xavier has been abusing me. But it will be sorted. But guys, I am really happy. I'm really happy that you enjoy the last of the 2 academic sessions. We are obviously over the top excited and happy to have brought these 3 days to you so far. But guess what? We have just 1 more day left. And I want to tell you a little about that 1 more day that you have left, because this 1 day is going to be a special day. Okay. So what's going to happen tomorrow is we're going to have a challenge, an intercampus challenge. So what's going to happen is tonight, representatives are going to come into your different WhatsApp group chats, because we need to select a team. We need to select a team of, I think, about 2 people from each campus, or maybe 3, and you can rotate. But we need 2 at a time. We'll publish the rules, and basically we're going to play a game of Family Feud, where some of the questions will be academic, some questions will be reviewing certain things that was said in the MedSkool KickOff and so forth, and just have a grand time. It will be fun. So I need you to invite. One of the things we want to know, we want to see which campus, Caville, St. Augustine, or Mona, can bring out the most people to the live tomorrow. So tomorrow there will be a competition of the campuses to see who can bring the most people out tomorrow at 4 p.m. to witness the intercampus feud. So just after, maybe about within an hour after we're done today, check the group chats for the questions on who are the volunteers. We need the teams, and we're going to come on here and we're going to have a team battle. It's going to be a team battle. So in fact, let's see if we can start the battle right here. I want you to represent your campus in the group chat. So I want you to put hashtag Team Mona, hashtag Team Cave Hill, hashtag Team St. Augustine. And I want you to represent with your flags. Let's see who has the most people out here. We see that Jada is representing both Mona and Cave Hill. Chad is on Team Cave Hill. Oh, it seems as if Jada is representing all campuses, which is all fun and good. We are from Team Mona, very good. Team Mona out here representing, wonderful. So tomorrow, that is what we're gonna be out here doing. So it's gonna be fun. It's gonna be lots of fun, and then we're gonna have a closing ceremony, just a brief closing ceremony to wrap up everything, and tell you more about what HyperAcademics has in store for you for the coming semester. Guys, every night for the last 2 nights, I've been going to sleep with my smiles on my face, and I wake up and my face just so, because I'm so happy for the wonderful time that we've been having here together. So with that said, sisters and brothers, I'm going to act like we're in church. I'm going to bid us farewell for the night. Tomorrow, remember, we come back here at 4 p.m. sharp like a razor. We come back tomorrow for the intercampus challenge. And guys, I am actually so excited for it. So remember, again, if you have any questions at all, find the WhatsApp group. Remember, guys, very important, very importante. Follow HyperAcademics on Instagram at HyperAcademics. And you'll get all the updates and everything. So until tomorrow, guys, have a wonderful evening and see you later.